Hi, so what brings you here today?
So I've been having a lot of discomfort in this spot on my face right here, and a lot of tension, and I grind my teeth at night, and I find myself clenching a lot. I went to the doctor and they told me I had TMJ, so I was wondering if there's anything that Botox could do to help that. I've seen some things online and on TikTok.
Yeah, yeah,
Yeah.
yeah. So that's actually your masseter muscle, and that's what we use for chewing and grinding and all of the things. And as that muscle, if we use it a lot, it can actually get really tight, and that's probably what's leading to some of the discomfort. So treating with tox can often relax that muscle, causing it to shrink a little bit. You will sometimes have some facial slimming because of that too. So some people choose to use that as a cosmetic benefit, but I also just warn just in case that's something that like some of my male patients, for example, might not want to see that. But that can happen. You can have a little bit of facial slimming. But why we would be using it is more for that kind of medical indication to make this muscle a little bit smaller, make it less intense. So then that way you have some, resolve of the pain. So typically it does require a larger dose because this is a larger muscle. But with time, if we start to see that the muscle doesn't require as much, then we can lessen it. But it's typical to start right around 20 units per side. That's a typical dosing, I would say. It can be as much as 30 per side too. The risk often is just a little bit of discomfort with the procedure, but it's not too bad. A little bit of bruising, possibly, again, not a huge risk. The biggest risk is if the Botox were to inadvertently get into a different muscle, a neighboring muscle like the rosaris or the DLI or something of that, which can affect your smile. The good thing with Botox is that nothing is permanent. It's the good and the bad, right? If we love it, it doesn't last. If we don't like it, it doesn't last. So, but that's probably less than 2% risk, and going to somebody who studies anatomy can also lessen that risk.
So I've seen online that some people that have gotten this type of Botox have gotten some jowling like in this area. So I was wondering if you could kind of give me some insight on that.
Yeah, so that can happen. The masseter is a large muscle, right? So for some people, it really helps to, maintain that jawline because it's providing like support. So if we shrink it too much, in theory, you could potentially have that loss of support. And so, I would tend to think that it's going to be more for somebody who's already kind of prone to jowling. You, at this point, I don't really have a concern for that at this time. But if we saw any sort of risk of that, a way to prevent it would be to treat along the platysmal band, which then offers a little bit of a lift. So there's things that we can do with tox, like, to kind of counterbalance the risks in a sense of like what that muscle's function does and making sure that it doesn't cause like a negative side effect of that.
The other question I had is